Hello and welcome to Unleashed, the show that explores how to thrive as an independent professional. Unleashed is produced by Umbrex, which connects you with the world's top independent management consultants. I'm your host, Will Bachman, and I'm here today with Jim Peters, who is the Chief Operating Officer at Rite Aid. Jim, welcome to the show.
Thank you, Will. Great to be here.
Well, Jim, there is so much to talk about. I'm hoping on today's show we can talk about the coronavirus pandemic and get into how Rite Aid has been protecting your employees and your customers, and also talk about a lot of the innovations that you have been working to implement at Rite Aid, including telemedicine and helping pharmacists operate at the top of their license and other initiatives. But first, let's talk about the pandemic. Could you tell me a bit about what Rite Aid's been doing in response to protect your employees, keep them safe, as well as customers?
Of course. Again, thanks for having me, Will. This is a real pleasure to be here. I've certainly been aware of Umbrex and your work for some time, and delighted to be a part of this today. Look, COVID-19 has certainly created some wild, unprecedented challenges for community pharmacy and frankly, the broader healthcare system. We've had to really balance the need to continue meeting the needs of patients and customers while we continue to kind of ramp up all of our efforts around coronavirus testing and frankly deploying our strategy that we unveiled in March at our first Analyst Day in 20 or so years. As far as keeping our associates and our customers safe, that has been obviously first and foremost priority for us. And it's been a challenge since day one, but a challenge that we've been up to. So, we've doubled down on cleanliness, as you might expect. We've got daily cleaning crews in all of our stores and certainly hotspot locations across the country. Our associates have been trained and responsible for cleaning our retail pharmacies themselves. That includes surfaces, registers, checkout areas, keypads, bathrooms, pharmacies. Anything that you might imagine needs to be 100% clean. We're really going above and beyond to ensure that that's the case. And certainly, taking care of our customers and associates, we've got to go above and beyond to do this. So from an associate standpoint, we've sent free health kits to every single one of them to ensure that they had adequate supplies early on in the COVID-19 pandemic when supplies were scarce. We've compensated our associates for time off due to quarantine or illness. In addition to our regular policies offering time off and sick pay, we actually established specific guidelines relative to COVID-19, including a pandemic pay policy for those confirmed with or exposed to the virus. And so while we're taking every step to keep our stores operating, we're certainly also being as flexible as possible with them, with our associates in particular who are unable to come to work by adding extra administrative leave options. We have created a $5 million contribution to support not only the nation's healthcare providers and first responders that are not directly tied to Rite Aid, but also children, families, communities impacted by the outbreak. And, bringing it closer to home, part of that $5 million is really to support our own associates who are in special need, the subset that are in special need as they continue to battle the COVID-19 pandemic. So this is, it's been an effort, Will, that we've had to really double down our efforts, not only in our retail pharmacies, but if you think about Rite Aid, we've got a central fill facility, we have mail order pharmacy, we have multiple distribution centers. So it's a more complicated network of physical modalities than maybe the average consumer might think about when they think of Rite Aid. We've really been, perseverating in many ways about making sure that every single option to care for our associates we've done. On the consumer side, our customers, we have really done things to protect them that actually, to some degree, serendipitously, were just accelerated versions of plans to support them better in the future, even absent COVID-19. So making our brand of Rite Aid accessible to them in ways that isn't limited by the physical in-store within the four walls interactions that historically have defined retail. What we believe is that we need to provide access to Rite Aid, whether it's through the traditional retail store, whether it's through online, whether it's through BOPIS, buy online, pick up in store, curbside delivery, offering an enhanced set of services and products through our drive-through, and now more recently, over the past couple months, being one of the earliest, the first wave of large retailers to stand hand in hand with Health and Human Services to stand up testing sites across our country to test for COVID-19 and keep our community safe. So it's really been an all hands on deck. No formula or recipe for success, but so far, as I pause for a moment and look back, while I'm never perfectly satisfied, I'm certainly of the belief that we've done everything we could have and will continue to do so to protect the safety and well-being of our customers, our associates, and our communities.
Could you talk a little bit about how the plan came together? So there's a lot of elements of what you just went through in terms of compensation for your associates, putting up plexiglass, implementing some telehealth, and then was there a kind of central team of 3 or 4 people making decisions, or did you delegate decisions so different levels of authority had different scopes to make decisions? Just how organizationally, I'm curious, in terms of responding to a crisis like this, did the decisions get made and then passed down?
The way that we did this is first we structured a COVID-19 task force, and that was comprised of operating and pharmacy folks from all facets of our business. It included key support functions, including human resources, but included, the entire everyone from our chief medical officer to our chief pharmacy officer to our head of, to our head of operations, retail store operations, to the head of our distribution centers, to ensure that we had a sufficiently broad view of what we needed to protect and how we needed to respond, or at least the areas in which we needed a response. That was a daily 7 a.m. and continues to be a daily 7 a.m. phone call that it really included all of those key components of our business as represented by those kind of leaders for those particular segments. The discussions were always led by, number one, an assessment of what is out there, because again, although COVID-19 rattles off our tongue today, I think back to late February, early March, it was still very much of an unknown, and certainly far more of an unknown then than it is even today. And so it was really about what's out there, what's happening, what should we be doing, what are others doing, what's our position, and really, I have to say, Will, being the size of Rite Aid, which is kind of a nice sweet spot to be, look, we're the smallest of 3 national chain drugstores. We have 50,000+ employees. We have about 2,500, just shy of 2,500 retail locations. We're about $22 billion in revenue. About a third of that revenue is from our PBM business. So we're small enough, certainly relative to others in the industry, to use nimbleness as a key differentiator, and we're big enough to be credible, where the work we do actually can have substantial impact when you look across the country. And so I think that sweet spot allowed us to, immediately pivot to having these 7 a.m. phone calls, and more importantly, frankly, following each of those phone calls, have a very clear action plan for the day, literally for the day, to be able to knock down the bowling pins for that day. And I have to give tremendous credit to our people who not only led those participated in that task force and continue to do so, but then led their teams to operationalize what came out of them. It's really been a Herculean effort for the past several months, it's been pretty awe-inspiring to see the changes not only, number one, happen, but happen with the degree of facility and efficiency that they have.
You mentioned setting up testing sites for COVID-19. Certainly we read a lot about that in the news, but what behind the scenes, what's actually required to set up a testing site just operationally? How does it work behind the scenes, and what did it take to get those set up at your stores?
Well, the first thing, Will, is to acknowledge that there is no recipe for what a testing site is or even should look like. We, along with our peers in the national chain drug space, Walgreens, CVS, even Walmart, early on, we all stood as a community ready to use our pharmacists to the best extent we could to support testing efforts. And from my perspective, when we first started, it was a very much of an unknown what a testing site would look like. And when we first started, we committed to a certain number or up to a certain number of testing sites, but acknowledged early on that we're a pioneer in testing, right? And so what we knew coming out of the gate that our first or second or third testing sites would not be ultimately the scalable version of the testing site, but you had to start somewhere. So the way we as a community started, and certainly we at Rite Aid, we had one testing site in Philadelphia that was a drive up to essentially a parking lot tent, undergo a nasopharyngeal swab, which is it's not only highly accurate, but it also happens to be among the most invasive of swabs that one could take. And we realized shortly thereafter that that model was not scalable. It required far too much PPE, which was in short supply, far more supplies than we could get our hands on collectively as a community. It required a level of human intervention that was not as sustainable as we would need it to have been. And so the benefit of us being kind of the first adopter or among the first adopters with that handful of first adopters was that we early on were able to kind of rapidly see what was working and what wasn't, and then make recommendations in tandem with the government and HHS to kind of develop a second type of testing. And that second type of testing, we built 25 locations, which were characterized by also in the parking lot, testing that was delivered through a series of tents that were drive-through tents. So meaning the customer now would drive up to the first tent to confirm registration, which was done online with our partners from Verily, and then drive up after confirmation of registration to a second tent to keep the line flowing where a swab was taken, this time a nasal swab. And with that process, with that pre-registration, with the process of moving through to multiple tents, we found that we were able to deliver more tests in less time in ways that were less invasive and more consumer friendly to the people actually taking those tests. That led us to a third round of testing. So we learned from that and learned that we can boil and distill this down now to a more efficient process that leverages our drive-through windows, our existing drive-through pharmacy windows that we have at half of our stores throughout the country. And we now have that model down to a point where we were able to go from 25 to over 70 sites, again, leveraging a much more efficient model where now a consumer only has to drive up to our regular drive-through window. Our PPE protected pharmacist will hand them a prepackaged swab kit for testing. The consumer is able to swab themselves, put it back into the kit, hand it back over to us in a sealed package, and we then take care of shipping it to our laboratory. That has become, kind of the current best model for testing. And, look, we're always looking for ways, Will, to become more efficient because in order for us to deliver the amount of testing that frankly needs to take place in this country, we're going to need to continuously refine the way in which we do testing and ensure that it's offered in the most efficient way at the lowest cost with the highest utility for our consumers. And that's kind of the path that we've been on since day one.
Let's pull back a little bit now from the coronavirus pandemic and talk about your the broader healthcare strategy at Rite Aid. And you mentioned earlier that some of these initiatives have been accelerated. I'm really curious to hear about that. Could you give us the overview? I know that one big element is helping pharmacists operate at the top of their license to unlock the value there. Maybe we could start there.
Sure. Yes, as you referenced, we have what we call three key strategic pillars that characterize the new Rite Aid strategy, and it's probably worthwhile to pause and just acknowledge that when I joined Rite Aid in October of 19, and frankly when Hayward Donegan, our CEO, joined just a month and a half or so prior to that, we both joined with eyes wide open that we were walking into a turnaround opportunity. So Rite Aid, first and foremost, was in need of a turnaround. And we are actively amidst executing on that turnaround plan with results that early on have been very promising. We also knew that, not only did we need to focus on short-term turnaround execution measures, but we also needed to provide a way for Rite Aid itself to thrive for the longer term. And, truthfully, the strategic plan for Rite Aid before us getting here had largely been to sell to an acquirer. And we really spent the first several months of us being here, Hayward and myself, developing a new strategy that sees us, number one, becoming the dominant mid-market PBM through our EnvisionRx PBM business, which is soon to be renamed Elixir. Number two, as you mentioned, unlocking the value of our pharmacists and having them work to the top of their license and frankly even push the boundaries through policy influencing of what that, the boundary of their license ought to be. And number three, renewing our entire omni-channel experience characterized by a much more pronounced capability in our digital. So those are really the three strategic pillars. Based on your question, perhaps I ought to go first into unlocking the value of our pharmacists. Does that make sense?
Right. And one couple things I thought were interesting were in the investor presentation how currently pharmacists spend about 80% of their time hidden away and only 20% interacting with consumers, and you're looking to flip that through changes in workflow and changes in systems. Would love, and maybe just for me, explaining a little bit about what pharmacists are typically doing day to day now, and what are they actually qualified and certified and allowed to do that in a lot of cases maybe you're looking to allow them to operate at that top of the license.
Sure. Well, it's interesting. So I'd love to address that, and it's interesting that your mind went right to, I think, where most of our minds tend to go to when we think about folks not operating to the top of their license. We think about what procedures, or in our case, vaccinations, testing, diagnostics, treatment. What can and can't they do from more of a clinical, perspective? But there's a whole element of part of their license. We like to think of one of the implied most important things that, again, is an implied obligation, frankly, of pharmacists to be able to work to the top of their license is to spend the requisite time and develop the requisite relationships with their customers. So speaking to people eye to eye, face to face, eye to eye, understanding them not only as consumers, but also as patients and also as community members. That is something that's suffering today, as is what I think is probably a more strict view of what pharmacists can do by today's licensure standards than I think maybe will be in the future. So I'll kind of break those out and address them both. On the first side, I'll spend a little time based on where your head was, I think, at first, which is what can they do today? Well, that really varies by state, Will. There are state requirements that that limit or expand what the license rights allow a pharmacist to do state by state. And so we have some states where we have fairly broad ability through our pharmacists to do a variety of vaccinations that go beyond, kind of flu and shingles and MMR. So we have a number of states that allow us to go beyond that into other types of testing and diagnostics that you don't see in other states. So it's a bit of a mixed bag. So any retail chain drug company like ours will have a heat map of each of the states and what you can and can't do within those states and the various policy, status within. What we know we can do everywhere is really be effective communicators with individuals who frankly are, suffering from access issues within the broader healthcare landscape. So I'm a healthcare guy, as you may or may not know. I came with 20 some years of experience in healthcare, integrated health system. I came from Geisinger most recently before starting Skyward. And, I know that two things challenge people's outcomes, right? And healthcare value, if you consider value as a function of quality over cost. One of those things is access. In many, many places, it takes far too long for people to be able to get to see their doctor. And when they do get to see them, it's often a visit that is, measured in minutes, often 10 minutes, 15 minutes max. And so people often don't get the appropriate level of access, even if they don't live in what they call a healthcare desert where literally the providers just don't exist. So that's important to acknowledge access. Another issue is trust. Folks have become increasingly, let me say it a different way. Folks very much trust pharmacists, who, by the way, are among the most accessible clinicians in the lives of a person, whether that person is a member of a health plan, which is the same person that is a patient of a provider, a doctor, and who happens to be our consumer. These people walk into a Rite Aid store or walk through our virtual front door of our e-commerce app or platform, upwards of 30 times a year in many cases. That is about 10 times the amount of interaction points that they tend to have with their doctors. And so for us, how do we as pharmacists leverage both the easy access that retail pharmacy provides, as well as the trust, which, by the way, you might find interesting, Will. Pharmacists and nurses tend to be neck and neck, depending on what surveys you may look at, as the most trusted clinicians within all of healthcare. So you think about all the types of clinicians, including doctors, and nurses and pharmacists tend to have over a 90% trust rating among people. And so for Rite Aid, we are just in a very powerful position to be able to be the important part of the the healthcare stakeholder chain to partner and impact outcomes in ways that can not only help consumers, but help the health plans that actually finance the care and the providers that are working their tails off to deliver the best care and outcomes they possibly can.
Yeah, Jim, I think a lot of people don't really use their pharmacists to the maximum extent possible. And I only learned this. I did a project about 15 years ago when I was still at McKinsey for a major pharmacy retail chain, where one of the goals was to get pharmacists spending more time doing consults with patients. And we put some operational things in effect. And as a result of that, I was reasonably well educated, college, MBA, et cetera. I didn't really even know that I should be asking this. So ever since, I personally, when I go and pick up some new, prescription, will ask for a consult and what is this for? How do I take it? When? Is there anything I shouldn't take it with? And what side effects should I expect? And the pharmacists are always happy to do it, but I think a small number of people even know that they should ask for that consult. And it sounds like you're taking some steps to make sure that pharmacists are proactive and delivering that advice, which some cases you don't know. Oh, don't take this with grapefruit juice. Who would have known, right?
Right. No, it's a great point, Will, and actually that gets to the second part of your prior question, which is So how do you make that happen? We can't simply ask pharmacists to spend a lot more time with individuals. And the reason is because right now, pharmacists tend to, only spend, they're forced in many ways based on existing process and to spend about 80% of their time behind the counter, not interacting with customers, filling pill bottles. I mean, essentially, that is a large part, unfortunately, of what these highly skilled, highly trained, credentialed, licensed clinicians are doing. A lot of their time, most of their time, 80% of their time is spent filling pill bottles. And there are a whole host of reasons why. And, truthfully, one of the most eye-opening experiences I've had early on, my first couple months here, was when we analyzed, we really conducted a deep analysis using lean methodology to understand and tease out the why to that. And the why for us has largely been, frankly, due to a very inefficient process to really maintain really skilled pharmacy technicians who are every bit as qualified to do, to fill the pill bottle, so to speak. But frankly, given turnover, historical turnover, it just, our pharmacists reverted to human nature, which is, given the high turnover of pharmacy techs, which is not a Rite Aid challenge, that's an industry challenge. Given that challenge, our pharmacists, instead of retraining the third, pharmacy tech within 2 years, they historically just began doing the work themselves, right? You can understand human nature. Once you try something a few times and to the best of your ability, it just fails, you tend to take on the work yourself. And so that work of filling pill bottles is more a function of us being inefficient as an industry in hoisting up and raising not only the pharmacist value add, but the value add of the pharmacy tech to be able to work to the top of his or her license, right? And to do so in a way that rewards those techs so that, they enjoy the job, they come to the job, and they stick with the job for a period of time that they just historically have not. So for us, what lean has been, we're the only, to my knowledge, large chain drugstore that has used lean as a way to tease out the opportunity to really emancipate our pharmacists from that work and then reversing that 80-20 to 20-80 so that now 80% of their time could be focused on essentially what they went to school for and what they became a pharmacist for and what they took an oath for, which is to work with people and help people achieve optimal whole being health. In our case, which is a combination of not only prescriptions, but also introducing them to therapies and options that go well beyond the pill. So for us, it wasn't a matter of hiring more pharmacists as much as it is ensuring that the processes of going back and filling pills and filling prescriptions can then, be handled by the right folks that are trained to do that. And so pharmacists can then be emancipated, as I said earlier, to not only work on the quality assurance aspect of pharmacy, but also that human interaction and connecting with people that are in the communities that we serve. And that already has begun to show tremendous dividends, not only in terms of impact we have on people's care, but also, frankly, the quality of life and associate satisfaction, both on the pharmacist side as well on the farm tech side.
Yeah. Can you share some of the changes that you have that you're implementing, using lean to reduce
Sure.
that time on task by the pharmacist?
Sure. I could certainly give a high level view of that. At a high level, one of the things that we are doing is really honing in on a proprietary tool. It's really a software tool that was built over the past handful of years that is one of the crown jewels of what I've at least been able to find since I've been here at Rite Aid. This is a tool that uses workflow to be able to identify care gap opportunities and intervention opportunities for our pharmacists to engage in the right conversations, not only with each other, but also with our consumers. And, it's called Right Care. I've referenced it on recent earning calls. In fact, I think each of the earning calls I've been on since I've joined, because it's able to message and alert, at the appropriate time to the appropriate consumer of information, be it a farm tech or a pharmacist. It allows us to alert them to the right intervention points and the opportunities to essentially make that particular personalized care journey that involves not only the pharmacist and the farm tech, but also the customer. It alerts them to optimize that journey on a real-time basis. And I think historically, Rite Aid has used that to its benefit to a good degree. But I think having come from healthcare where alerts are terrific, over alerting is not only not terrific, it's actually counterproductive. It's been there's a real parallel that we've been able to draw between over alerting in the healthcare world and on the provider side in particular, with over alerting in the pharmacy. And you really there's that point of diminishing returns beyond which the next alert will have less of an impact than it ought to. So we're actually dialing back the alerts in order to dial up the impact of a more limited set of alerts that are on a critical path that is really designed to help the consumer achieve optimal, health outcome, and frankly, for us to support that journey in the most efficient way. So that's one example of using technology. Another is frankly sharing workloads across multiple sites. So when you think about the reality that we could have 5 locations within 10 miles of each other or 15 miles of each other, and at any one given time, we could have 2 pharmacies that are, frankly, over capacity, and the other 3 are under capacity. It's bellowing that demand with the supply that we have, not simply within the 4 walls of one pharmacy store, but also the 4 others that might be in that example within a couple handfuls of miles around. So making sure that workload is distributed in a way that allows us to be more effective as an overall system, as opposed to simply as a single store. So those are 2 that come to mind. And I guess the last one is just around the way we manage inventory. We've had a opportunity to identify inventory that frankly just doesn't turn. This is on the front end of our business. Inventory that just doesn't turn or turns maybe once a year. We've really used Lean to be able to identify the cross-section of those products that, frankly have low turn and low return. Return. And for us, doing that has allowed us on the merchandising side to really double down on those products that we ought to enhance or expand, but also, frankly, eliminate products that are not only low moving object products, but ones that provide little return to Rite Aid. So again, in simpler terms, products that nobody wants, and that when the few people that do want to buy them don't do much for us at Rite Aid.
Could you spend a minute talking about your telehealth initiatives?
Sure. Yeah, that's one, Will, that has absolutely been catalyzed, actually born as a result of the COVID pandemic. So Rite Aid has dabbled in retail care, and I say dabbled deliberately. We had about 65 sites throughout our footprint that are retail clinics that exist in some cases within Rite Aid stores, in other cases within partner grocery stores. We never really set out to, and currently as part of the current strategy, our goal is not to own primary care. You may have heard me reference that during Analyst Day. In fact, I feel very strongly that we as a key part and a last mile extender of the broader healthcare chain, including providers and payers, we need to support them and be the glue that keeps people connected to their care teams, not become the care teams, if that makes sense. And so for us, that means that we need to do, as part of our go forward strategy, our focus is really about keeping people connected to their care teams. So before COVID, our plan was to accelerate our plans to deploy a telehealth option that doesn't simply connect people to our own clinicians, but actually connects people to clinicians of our provider partners or our health plan partners who may have a care management team that is there to support their members that happen to be our customers. And so that whole plan was catalyzed because of COVID. So we had a plan to deploy that over the 2 quarters that, frankly, would have brought us into later this calendar year. And, within 2 weeks into COVID, when I found myself in discussions with our folks about shutting down our retail clinics to keep not only our customers safe, but our associates safe that work within those clinics, we migrated and stood up a telehealth offering within about a week and a half. And again, points to the nimbleness of our people at Rite Aid. And we now have a Rite Aid virtual care that we have stood up, and we see many people every single day that we never even contemplated seeing until the end of this calendar year. So we've already stood up a virtual care platform that sees our own people, nurse practitioners and otherwise, serving the needs of people who, frankly, no longer wish to go into not only one of our own retail clinics, but they don't want to go into their primary care doc office. Now, as a matter of philosophy, we do believe that folks will decide to return increasingly to their physicians, and we actually hope and encourage them to do so. We do want to be, given that we are seeing folks in store, 30 times a year, give or take, and so the same people online many more times, we do feel that we want to take advantage of the opportunity to continue to connect those people when appropriate to their care teams through the providers with whom we're partnered with. So for us, COVID-19 has absolutely catalyzed our telehealth capability.
After you left Geisinger, you started up your own boutique advisory firm, Skyward Health, and I think you did that for 3 years before you joined Rite Aid. A lot of listeners to the show are independent consultants or running boutique firms. Could you reflect on that time period? Any tips that you have for someone who's running a boutique firm but potentially interested in transitioning to an executive role? And any tips or other reflections from that time?
Sure. Well, I'm not sure I can give many tips on transitioning back to an executive role because I had no intention of doing so. But the Rite Aid opportunity came, and as I kind of did my own due diligence, it became an opportunity that was simply too exciting an opportunity not to pursue. I would say that the 3 or so years I had building Skyward was among the most rewarding 3 years of my career. And it was because I took the great experiences I had had within healthcare, first as a venture guy, and then as a leader, part of the leadership team within Geisinger. It allowed me to package and then unpack a lot of the learnings and experiences I had serving Geisinger on both the payer and the provider side, and unpack that for a constituent base that went well beyond one organization. So for me, the liberating part of being kind of more independent than a W-2 employee of a large organization was that I was able to impact a whole series of problems that were very similar to the ones that I attacked with my team at Geisinger, but do so nuanced by the various needs and market positions of handfuls of clients. And that to me was frankly allowed me the opportunity to have an impact that was just a little bit more broad than maybe the impact I thought I might be able to have at any one single organization. And plus, frankly, such an amazing time I had in my 12 plus years at Geisinger. It was almost so good, I really didn't want to even attempt to replicate it at another similar opportunity, even within, really good, interesting, credible IDN peers. So I guess the advice I would have is when it feels right to move on, move on. And if you feel that, the opportunity to impact a much broader set of constituents exists by going the independent route, To me, I've gone that route twice in my career, and both have been exceptionally rewarding. So I would encourage anybody who thinks that might be the right thing to do to not only do it, but embrace it wholeheartedly, go in with both feet, and really be particular about who you work with and on what type of work you take on. I think, Will, you could appreciate this, I'm sure. Early on, I know when I first left Geisinger, you know, there's always that I think push and bait to take on your first few opportunities that come your way, because you've gone now from a nice, steady, healthy paycheck to one that is non-existent. But I guess my experience has always been it really pays off to be very selective, even on that first client. Don't rush back into it to the greatest extent your resources will allow, because the first opportunity will define the way you think about your next opportunity and will pave the way for the next opportunity. So I think, much like an expression I often use that I learned from my 8th grade football coach, the first hit in the football game is always very, very impactful, if not the most impactful of the game. I would say the same thing for the first opportunity you take when you go independent. Make it the right opportunity. It'll define whether or not you love what you're doing and validates the reason you left, or the inverse of that, which obviously my comments are designed to help you avoid.
Couldn't agree with that more, Jim. And that first project you pick, and all the projects, it's so important to pick the right projects. And when you're an independent consultant, so you can really be delivering the best service. Jim, I want to thank you so much for joining today. This was really a fabulous discussion, and I appreciate you, walking me through what Rite Aid's been doing to protect its employees and its customers, and more broadly, how you're innovating.
Well, I appreciate it, Will, and I really admire what you're doing and creating a voice for all those that feel like they're on an island. I think, you coalescing all those voices and providing an avenue for people to kind of learn from, and just frankly having a support system to get them through the tougher times with being on your own and building a business. It's a tremendous asset that you offer. So my pleasure to be here. Thanks, and be well.
Well, thank you, Jim. And for any listeners who are interested in starting in independent consulting, we've just released a guide on the Umbrex Guide to Setting Up Your Own Consulting Practice. It has 90 videos and over 30 templates and downloads. So if you go to umbrex.com, click on Set Up Your Own Consulting Firm, and you can check that out. So, Jim, thanks so much for joining today.
Thanks, Will.